This is the Da Vinci surgical system being used to stitch the skin back on a grape. As you can see, the machine is extremely precise. When used on humans, it used the same precision to perform complex, minimally invasive surgeries with ease. Many new operations that were previously impossible are now possible because of the invention of this device. Robotic surgery is a form of surgery where surgeons use robotic arms to assist them in perform complex operations. In the year 2000, the FDA approved this device. Now there is around 210 of the Da Vinci surgical systems in the United States, Japan, and Europe. The device has mechanical arms that enter the patient and perform complex actions in the operation area, and a camera that gives doctors a three-dimensional view that magnifies the part of the body that the doctor is working on. Robotic surgery is more precise than non-robotic surgery. Patients have been more open and confident in robotic surgery because of convincing benefits. Because of how precise the small incisions are, there is far less blood loss and much smaller scars. The patient's recovery is less painful, and the recovery time is much shorter. This image shows the scarring on a patient after surgery. On the left is from a traditional open surgery. In the middle is from a laparoscopic surgery, and on the right is from a single-site robotic surgery. Some cons of robotic surgery are that it is less cost-effective. For example, robotic surgery costs an average of $2,504 more for removing ovaries and $3,311 more for removing cysts. Also, it could be more dangerous. Records from the Rush University Medical Center, the University of Illinois, and the Massachusetts Institute of Technology have told us that there have been an alarming increase in injury and death reports in the last 10 years. In 2004, there were only 13 reports out of 100,000 procedures. In 2012, there were 50 reports out of 100,000 procedures. Also, as time passes, there could be no need for surgeons as robots become more and more precise. One could argue that this is bad because robots are incapable of experiencing human emotions, which could lead to indirect mishaps and accidents. To gain more information on the topic, we interviewed Lauren Greenfield. She's a physician's assistant, which means she works alongside the surgeons during an operation. When asked if robotic surgery has a negative or positive impact on the medical world, she replied with the following. A mixture of both, I think. It's positive in the fact that the accuracy of things is so dead on, so you don't have to worry about the error of surgeons. The bad part is that it takes away the humanity of things in the sense that you don't have the intensity. There's a lot of emotion that goes into it. When asked if this technology would be beneficial or detrimental to the future of surgery, this was her answer. I think computers as a whole are beneficial in a lot of fields, but I think they will also be our demise. If it becomes so robotic, you lose a sense of empathy, and that's frightening. There's no question about it. Surgical robots are the future. But one question remains. What impact will they have? Positive? Negative? Or maybe a little of both?